I'll wash my hands. Good afternoon, my name's Claudia. I'm gonna be your student nurse for today. I'm just gonna start off by asking a few questions. Can you verify your name and date of birth with me?
Cachalis, July 15, 75,
Okay, perfect. And can you tell me the date today?
November 18th, 2020,
Perfect. And tell me where you are.
at the hospital
And why are you here?
for assessment.
Okay, so just by talking to my patient, I can tell that she's alert and oriented. Her speech is clear and appropriate for situation. Her skin color is pink and appropriate for ethnicity. And ABCs are normal and intact. So from then I would gather my patient's height and weight. I would calculate BMI. I would also get my patient's vitals, including blood pressure, heart rate, temperature, and respiration. And then we would go on to checking vision with the Snellen eye chart. So first, I'm just gonna take a look at the head, the face and head, and I'm just noting the shape and size first. Then I'm going to palpate and inspect your head. And I'm looking for lesions, masses, other abnormalities, and tenderness. After that, I'm going to palpate the temporomandibular joint. So go ahead and open and close your mouth, and side to side. And I'm checking for crepitations. Next, I want to check the face for symmetry. So smile for me, frown, close your eyes, open wide, and then show your teeth. Perfect. So I'm checking symmetry there. From there, I also want to palpate sinuses. So I want to palpate maxillary sinus and temporal sinus. Any tenderness?
No.
Okay. From there, I'm going to go on to the ears. I'm going to inspect and palpate the external pinna and meatus. So I'm just inspecting and palpating, noting the temperature, looking for lesions, abnormalities, tenderness. Then I'm going to proceed with the whisper test. So just repeat what I whispered to you.
Red Christmas. Purple pillow.
Okay, perfect. So after that, I'm going to go on to the nose, and I'm going to inspect and palpate the external nose, noting any lesions, masses, tenderness, any
No.
pain. And then I want to check patency of your nose, so close one nostril, breathe in, close the other one, breathe in. Any difficulty?
No.
Perfect. So then I'm going to go on to the eyes. First, I want to check the sclera and conjunctiva. Then I am going to ask you to just follow this pen with your eyes only. Don't move your head. So we're following all 6 positions of gaze, and then going back to the middle. And then follow this, and I'm going to go right to the middle, checking accommodation. And your eyes are supposed to go together. So then I also want to check pupillary reflex. So I'm going to shine, just look straight ahead, and I'm going to shine a light in your eye. And there I'm checking for perla, so I want to see your pupils are equal, round, reactive to light, and accommodate. So that is perfect. After that, I want to go on to the mouth. So first, go ahead and open your mouth. I'm looking at the lips, buccal mucosa, the teeth, the gums. Open, open. I'm looking at the bottom of the mouth for any cancers. I'm looking at the tongue. I'm noting the tonsils, the upper or the hard and soft palate, and I'm noting the uvula. Also, go ahead and open your mouth and say ah. Perfect. And stick out your tongue. Perfect. So from there, I want to go on to the neck. So first, I'm just noting any swelling in the neck. I'm looking at parotid glands. I'm looking at salivary glands. and the thyroid glands at the base of the neck. Then I want to palpate my carotid artery. So I'm palpating both sides, making sure it's not bounding and it's not too weak. Then I'm going to listen for a bruit for both sides of my carotid artery. We do that with the bell. So I'm going to have my patient take in a deep breath and hold it. And let go. And take in a deep breath and hold it. Perfect. So after that, I want to go on and palpate the lymph nodes. So first we're going to do preauricular, postauricular, occipital, submental, submandibular, jugulo-digastric, superficial cervical, deep cervical chain, posterior cervical, and I want you to shrug up, and the supraclavicular. Perfect. After that, I'm going to check range of motion. So look up, down, side, side, and then ear to shoulder, and move your shoulders up while I shrug down against resistance. Perfect. So while we're still on neck, I'm going to also check the jugular vein distension. So I'm going to have my patient lay down at least 30 to 45 degrees. Then turn your head, please. And I'm noting any distension here in our jugular vein, and look the other way. And again, I'm noting distension, any distension in the other jugular vein on the other side. So go ahead and sit back. After that, I want to go on to upper extremities. So first, I'm noting the skin. I'm looking for any lesions, masses, abnormalities. Then I'm going to palpate for skin temperature. I'm going to go down and feel both radial pulses, make sure they're bilateral. Then I'm going to go to the fingers. I'm going to palpate fingers. I'm checking nail consistency. I'm looking at the nail profile, and I'm checking cap refill. And then we're going to check strength. So go ahead and squeeze my fingers. Okay, and then hold your arms up for 5 seconds, or 10 seconds, 1, 2, 3, 4, 5, 10. And now do this, and push against me, and push back, and stand up, and arms up, down, from the side, up, down, and then from the back. Perfect. So go ahead and sit back down. Then we're going to go to the chest. So first, I just want to note breathing. I'm noting rate, rhythm, and depth of breathing. I'm looking at the anterior chest. I'm noting any accessory muscle use. I am also noting skin color, looking for any abnormalities, masses, lesions. And then we're going to go to the posterior side. So just turn a little bit this way. Yeah, I just want to look at your back. And then I'm going to do the same thing on the back. So again, noting skin color, any abnormalities, lesions, macules, papules. So then back to the front. Sorry. I'm going to auscultate our lungs now. Okay, so go ahead and take a deep breath. Okay, and I'm going to do the same on the posterior chest, so I'm going to do it on the back.
So go on the back.
Just turn around. I have to listen to your back, sorry. Yeah, just sideways, that's good. That's good. So again, I'm listening to the posterior side. And just take deep breaths. And then I'm going to auscultate my 2 lobes on the left and my 3 lobes on the right. Okay. And I was able to hear bronchial sounds here, bronchovesicular, and then vesicular in the periphery, and same on the back. So after that, I want to move on to the heart. And first thing, I just want to listen to my apical heart rate. So we're going to find apical heart rate. And we're auscultating for about a minute. After that, I'm going to listen to my heart sounds. So I'm going to do that first with my diaphragm, and then I'm going to listen to heart sounds with my bell. So we're doing it twice. So first, I want to listen to aortic, pulmonic, tricuspid, and mitral. And then I'm going to do that again. I'm going to listen to heart sounds with the bell of my stethoscope. We're listening to aortic, pulmonic, tricuspid, and mitral. And I was able to identify S1, S2, no other extra or abnormal sounds. So after that, I want to move on to my abdomen. So you can go ahead and lay back. So first, I'm going to note the contour of my abdomen from the side. I'm looking at symmetry from the front. Then I'm going to go back to the side, and I'm going to note the skin characteristics. I'm looking for any lesions, scars. Then I want to look at the umbilicus. I want to look at any pulsations above the umbilicus. After that, I'm going to palpate or auscultate all 4 quadrants. So I'm doing that with my diaphragm. After auscultating my 4 quadrants, I want to listen to my vascular sounds. So first, I'm going to find my aortic, which is 1 to 2 inches above the umbilicus. And we're doing that with the bell. And then I'm going to listen to the renal arteries, which are on either sides, on both sides of the aortic. And then after auscultation, I'm going to do light and deep palpation. First, I'm going to start with light palpation, and I'm just going to palpate all around the stomach. And just let me know if you have any tenderness.
No. No. And no.
Okay. And then I'm going to do deep palpation, so I'm going to go a little bit deeper. Let me know if you feel any pain or tenderness. And again, I'm going to go around your whole abdomen. Okay, no pain, no tenderness?
No.
Perfect. So after that, we're going to move on to lower extremities. So go ahead and sit down for me. And first, I'm just inspecting the color. I'm looking at skin color characteristics, any lesions, scars, anything like that. Then I'm going to palpate the lower extremities for temperature. I'm looking for any lumps, bumps. Down here, I'm palpating for edema. I'm going to go down to the toes. Here, I'm going to find pedal pulses on both. And then I'm going to go down to the toes. I'm going to check cap refill on both toes. I'm checking nail consistency. and the nail profile. And while I'm down here, I also want to do the Babinski reflex. So I'm going to go up. Okay, perfect. So after that, I want to check the range of motion and strength. So go ahead and lay down again. And straight. Lift one leg for 5 seconds. 1, 2, 3, 4, 5. Other leg. 1, 2, 3, 4, 5. Then I want you to push up on my hands. Push down. Okay. Checking strength in the toes and feet. Then after that, I want to check range of motion. So take one leg, bring it out, bring it in, bring it up, bend your knee, and bring it back down. That one out, in, up, bend your knee, and down. Okay, perfect. After that, I would also like to check neural status. So go ahead and sit back down again. First, I am just going to check the light touch. So I'm gonna have you close your eyes, and when you feel the cotton swab,
Okay.
just say now. Close your eyes.
No. 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 No.
Across.
No. 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 No.
Okay. After that, I want to do the dull and sharp discrimination. So this is dull, and this is sharp.
Okay.
So go ahead and close your eyes.
Sharp. Dull.
This is dull. This
More
is sharp.
Okay.
Okay.
One more time. Dull. Sharp. 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 Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Dull.
Okay. After that, I want to do the rapid finger test. So with both your hands, touch your fingers to your thumbs as quick as you can. Quicker. Perfect. After that, we're going to do the the heel to shin test. So with the bottom of your shin or bottom of your heel, just drag it down your shin. And do it the other one again. Perfect. So after that, we're going to do the Romberg test. So I'm going to have you stand up. And we're just going to stand still for 20 seconds. You're going to close your eyes. And we're standing still for 20 seconds. All right, it's been 20 seconds. Next, I'm going to observe my patient's gait. So I'm just going to have you walk straight normally. Okay, and then when you come back, I want you to do the heel to toe. Perfect. Okay, after that, I would like to check, you can go ahead and sit down. After that, I would like to check deep tendon reflexes. So we're going to do the quadricep reflex first. Okay, so that's perfect. And next I'm going to do the bicep reflex. So go ahead and relax your arm. Just relax. And I'm going to tap this tendon right here. Okay, so that is good. And lastly, we are going to check the spine. So I'm going to have you stand up and just turn around here. And I can see that normally we have a convex thoracic and a concave lumbar. And here I'm also looking at the shoulders and the spine for symmetry and evenness. And then go ahead and bend down, touch your toes. And here I'm noticing the nice C shape, C curve, and I'm also looking at the shoulders and the spine here for symmetry and evenness. So go ahead and stand back up. And and I'm gonna hold your hips and we're checking range of motion. I'm gonna hold your hips and just move your upper body. Okay, perfect. And that concludes my head to toe assessment. Thank you.
Thank you.